Right. So just like health insurance or anything, right? It works for your family or someone that you know, but it's not work for you. Everybody's different. Your own situation is different. So that's where it's unique in that way. So I can't say, okay, well, just say in general, 70 is good, but what if you don't have a good health? Right? And so you said, well, I don't have a good health. I don't know how long I live. So I wanted to be able to using that benefit now to pay for medical bills or whatever that may be.
Hey there, welcome to the Living Well and Aging Smart podcast, the podcast for seniors who are navigating the next transitions in their life, the chapter that should come with purpose, with wisdom, a little bit of humor, and hopefully some camaraderie. I'm Mitch Schwartz, broker salesman 19845 with Keller Williams The Marketplace. I'm a a certified senior advisor as well as a senior real estate specialist. That means I help seniors a lot, right? And here's the thing. We're going to be talking about lots of stuff on the podcast from time to time. It airs every week. We're going to talk about scams. We're going to talk about health. We're going to talk about insurance. We're going to talk about service providers. And more importantly, talk about being connected with one another. Right? That's super important. Every week we're going to discuss topics. We're going to discuss events and things that matter to folks just like you and I. Aging in place, navigating the next transition, protect your legacy from outside intruders, and yes, from time to time we'll talk about real estate because I think it's important that we have a clarity around that and we give you the opportunity to answer the right questions at the right time. See, this isn't about sales, for me anyways. This is about stories, it's about insights, and more importantly, it's about genuine solutions that you can use. By bringing the people into your world that I think can help you, service providers and professionals who know what the heck they're doing. And they're going to be able to help us. These are people who really care about our community, okay? So thanks for being here. Let's dig right into the interview and let's have a great podcast. Today we're going to discuss more Medicare stuff with my friend Sandy Kemp. She's not only a senior Medicare advisor, she is also a registered Social Security advocate. She can help you figure out whether or not you're getting the right benefits, when to pick them, when not to pick them, the whole bit. And she's really going to get us going and talk to us specifically about those items during today's podcast. I hope you'll stick around.
Yeah. Thank you for inviting me, and I'm glad you're here about education. Do you remember when we met at, we met several times, but at the event where Dora, have on here. And I know in that meeting we were talking about education, and to me, that said itself right there. Education to get people educated to understand where they're coming and going for that. And then to know the resources, because my experience has been people just don't know the resources.
Right.
And that's where, to me, I'm, passionate about that, to say, hey, did you know that this or that and whatever. So to understand that, then they can make a better decision for themselves,
Exactly.
Informed. So.
And one of the things I like about you are education-based, not just in the giving education, but you also learning-based, right? You go out and educate yourself. So why don't you tell us a little bit about what brought you to Vegas, what you do before what you do as an advocate, and what brought you to becoming an advocate? Because I think those things are important for people to hear.
Okay.
So,
do you want me to start that?
Yeah, just having a conversation.
So, I originally from Vietnam, and I came to United States in 1975 because the communists took over South Vietnam, which is we non-communist. And since I moved here in 1975, I moved a lot, mostly because of my ex-husband's job, and my mom just loved to move. But anyway, I moved. Prior to Vegas, I was in Houston. And I was helping my ex-husband with created by them. Medicare actually came out with the electronic health system.
Right.
And he and I actually working with my brother. I'm help designing it, where my brother is actually in the technical part of it, and then my ex-husband is in marketing.
Oh, wow.
And yeah, so I'm in healthcare since 1980, and it kind of stumbled on it. I was in college and I got a job working in a medical practice, and I just liking it. So I started with just a receptionist, and then just go further from there, billing, coding, and all that kind of stuff. So I really
So you saw it from the inside.
yeah, so for that, I pride myself as being different than most agents because I'm in healthcare systems since 1980. After working for medical practice for 9 years, then I said I want to learn something new. So I went and worked for an insurance company. So I process medical and dental claims. This is where I feel like I can help my clients to fight for their right, because there's a provider out there billing them the way they're not supposed to, or a claim was not being processed correctly. So, so anyway, so that's where I'm at. So I have processed claim both the individual, group, insurance. So that's why. And then when I was in Minnesota, like I said, I move a lot. I had 9 years experience with long-term care.
Oh,
so from
like in a facility, long-term care,
no,
or long-term care insurance?
No, long-term care insurance. So we started with PERS, with California, the state of California. So we do the administration for them, from the applications to the billing, and to filing the claim, and to process the claim. So I have done all that along with customer service. And this is where my pet peeve comes in. You know, customer service means a lot to me.
Right.
And I want other people experience that. And I want to experience that for me too, you know, as a customer, no matter what I do,
Right.
no matter in what field. And so moved here, 2011, and my brother introduced me to, he's a CFO at the time at Paiute Golf Course.
Oh, yeah.
So he said, oh, you know, I know someone I can introduce you to. So I actually end up helping, which that's also my specialty, is an account receivable. So I worked for a big medical practice. So while I was there, I have a lot of interaction with patients, and they ask me all the time as to insurance. And I thought, you know what, maybe there's a need for me here. So that's how I became an insurance agent. As I'm doing Medicare, actually I was doing the exchange as well. Mm-hmm. Then I want to focus on Medicare because I wanted to, as we talked a little bit earlier, but I wanted to find out all the different resources for my senior. And that's one of the many reasons I go to Sing, which we both go to Sing, right? And also others, networking out there, that mainly resources for seniors.
Right.
And so anyway, and then people, as I don't know if you're aware, Medicare and Social Security are connected in a way.
Yes, they are.
And so people are asking me questions, and then I said, you know what? I wanted to learn about it. So 2 years ago, I was lucky enough, a friend of mine who's a financial advisor, and he said, hey, there's a course that you could take. And that was it.
Wow.
I took the course, and so I've been, we consider ourselves as a registered Social Security analyst. So I can help people to say, hey, what's the scenario, how you maximize your Social Security benefit, as to when to file, what month, what day, and those kind of things.
Oh, so in other words, you can help. It's like somebody's getting close to where they should be considering it, right? I think 62 is the youngest age you can get it, but
Correct.
Does that make sense based on their picture to get it now, or should they wait until they're 70? A lot of people think that 70 is the time, and I look at financial, I think, well, maybe probably earlier, because the time value of money says the quicker I can start getting the money, the better. Just because it's not going to be as big a check, that might be best for me, whereas somebody else might need to wait.
Correct. So just like health insurance or anything, right? It works for your family or someone that you know, but it's not work for you. Everybody's different. Your
Right.
own situation is different. So that's where it's unique in that way. So I can't say, okay, well, just say in general, 70 is good, but what if you don't have a good health? Right? And so you said, well, I don't have a good health. I don't know how long I live. So I wanted to be able to using that benefit now to pay for medical bills or whatever that may be.
Oh,
So,
sure.
Yeah.
And like I said, I mean, if let's say, take for instance, the way it's set up, you may be able to get Social Security, still have an income, and now you use that Social Security money to save or prepare for a time in the future that you might need to have a little bit more of a cushion. You can do that. I mean, there's lots of things that can be done with that. I counsel people all the time, and that is my role as a certified senior advisor. I talk to people about that all the time, and that's why being that and hearing you talk about Social Security, it piqued my interest because certainly you can't know everything about everything, right?
Correct.
I can know a bunch about a few things. And so that's what I focus on. But I'd rather have people in my world who understand the things. So I want to be the person to say, okay, you don't talk to me, talk to Sandy. Or you don't talk to me, talk to Dave. That's what I want to be. As I jokingly say, I got a guy. Or I got a gal.
But it is true, right? Not all of us good at everything,
Right.
and so we focus on certain things. That's where we're good at, and that's why we're good at it, because we focus on that.
Yeah.
And to me, I think that's the way it should be, because you can't be good at everything.
Nope.
You're gonna miss something. But if you get an expert on that field, then he or she gonna be good at it and actually lead you to the right information that you're looking for.
Well, it's like if I have a problem with my heart, I'm not going to go to the podiatrist. I'm going to go to a cardiologist, right? Because I want to work with a guy who understands, or the gal who understands that. The podiatrist might be an outstanding doctor, but doesn't understand the heart, right?
Correct.
So that's important. So let's dig a little bit deeper into the advocacy or the Social Security thing. Tell me a little bit more about that. Like, is it just tell me. So I say, okay, I need help with my Social Security. What's the process with that? What do you do?
Okay. And actually, I just helped a client earlier today, just before I come out to this podcast. So she's 64. So she's thinking about retirement. And so I said, okay, so the information that I need to know, I do a little bit different than I feel most of them, because related to health insurance, related to Medicare. So I said, okay, well, let's just say that you retire at 64. Have you thought about that 1 year until you're 65? How are you going to pay for your health insurance? Right. So because everything is about finances as you retire, right? So I giving some thought about that, and I said, okay, well, do you have long-term care? Do you have life insurance? So how much are you gonna need? You think that you're gonna need to retire, by monthly. So let's just say, example, you need $4,000 a month, and let's just say you get $2,000 in Social Security. Well, where are you gonna make up the other $2,000? So this is where your financial advisor comes in to say, okay, well, you have this investment, that investment, and whatever, and how that and then you look at the longevity, like her family is 90. So I said, from 64 to 90, you're looking about 26 years. Yeah. So does your money going to last that long? And how are you going to make that up? And then you have to think, what if I change my mind a year later? And I'm going to go back to work. Because my experience has been, most people say, I'm so ready to retire at 62.
Until they do.
Until they do. After 6 months, they say, I'm ready to get back to work. Yeah. So I said, think about it. So how are you going to pay for your health insurance? And then if you wanted to work, I give them the number, Social Security, how much you can make in order not to pay extra taxes and things like that. So a lot of information that I ask them, right? Well, what your vision of retirement would be, and then asking a lot of questions, and I have a form for them to fill out, and based on that, then I run an analysis basing on the 62 to 65 to 67 to 70.
Right. Wow, that's crazy.
Yeah.
So, what if somebody has a hiccup with Social Security? Do you go in and take a bat for them, or do you say, "Listen, I can't actually go to Social Security, but these are the things I know you could do"? Is that kind of how it works?
Yes.
So if somebody feels like they're getting a raw deal, you just kind of point them in the direction and tell them the things they can do, but you can't go there and say, I'm here to represent Mitch, and he feels like he's getting screwed. That's not you.
Yeah, unfortunately, that's I couldn't do that as well. So I would say when a person come to me, they say, well, okay, so let's take a look. So I come back, look at all that informations, and I said, okay, these are the steps that you need to do. We need to make an appointment, right?
Mm-hmm.
And I can be there, not like as if they're asking a question that you might not understand, or just prep them for that meeting to have a rebuttal or whatever it is with the Social Security office.
Right. Wow.
Yeah.
Interesting.
Yeah.
So, because again, Social Security and Medicare are tied to each other.
Correct.
And I've learned that it's because obviously, based on your employment or not, will determine what you do or don't pay for Medicare A, right? And if you worked enough and they ascertain that, then you prepaid for that in advance, so you get it. It seems like it's no cost, but you already paid for it. But if you didn't, they know, and then they're going to charge you, right? So, with that being said, how then do you advise people when it comes to choosing what to do with their Medicare?
So first of all, when they think about retirement, and I wanted to clear on this, a lot of people seem to be confused. I said, when you think of Social Security, you think of money. And when you think of health insurance, you think of Medicare. So they are different. A lot of people still have them mixed up. They think that they're the same, and they're not. So let's just say that this particular client of mine today, she said, okay, I'm 64. I think I'm retirement. But what if I work? I said, okay, so let's take a look at, let's just say you're 65, or even now, then you wanted to retire. So then we can take a look at what you have right now through your employer plan versus Medicare. And see so I do a comparison between the two. Which one give my client the best benefit with the least,
At least out of pocket.
Yes. Yeah. So I do the comparison on that.
Oh, that's fantastic. And obviously you help decide, do they stay on, A, B, and D, or do they go to an Advantage plan?
Correct.
Right? You help with those choices. And, obviously the Advantage, I figure it's an advantage because they're taking the money from the government and they're saying, okay, through economies of scale of everybody saying we're getting all this money and we can provide more services because we're not the government and we're more efficient. And that's kind of what that is, right?
No, not really.
No.
A lot of people said to me, now, how is it I can get an insurance plan and a Medicare and don't have to pay any premium? We are just so lucky in the state of Nevada because we are senior state, retirement state. So a lot of people come here. So our Medicare insurance plan is really robust. And there's more and more carrier wants to be here because they know that they can get a lot. So seniors in here. So the way how I help my clients and say, I ask them questions. Who's they seeing? Do they want to keep that doctors, the specialists, the medications, all that. Now, affordability of any insurance, whether it's car, home, life, whatever, to me is very important. Can you afford it?
Right.
If you can afford it, you can have the Cadillac, the top of the line, just like buying a car or a home, right?
Right.
If you can afford it, you're going to buy the best of the best.
Right.
But if you can't and you have some health issue, there's some guarantee issue in health insurance. So I'm looking at the whole pictures and not just say, okay, because you have A and B, and I think this is, and so with that. Now, when it comes to Medicare Advantage plan, what it is the government outsourcing to all these insurance carriers, and they still do original Medicare. So so they said, okay, now let's just say United, right? So we're going to give all the insurance carrier the same amount as you, a Medicare beneficiary. We're going to give you, the government going to give the insurance company $1,000 per person, per member that sign up with that carrier. So on that $1,000, you had to spend 85% to pay claims. So whatever it is that the Medicare beneficiary needs, right, to manage that. And then the other 15% is to pay for administration costs, that including agent like me.
Okay.
So that's how, as an agent, that's how I make my living, basing on the commission that I receive from the insurance carrier. But as a Medicare beneficiary, which I am, so then the insurance company, the carrier, in this case, United, they have to spend $850 at a minute, to spend on whatever medical bill that I may have. I just say they manage well because they wanted their members, they have, say, 1,000 members. And last year they managed well, and then they didn't have to use that $850, right? So what they're going to do, the following year, with the surplus that they have, they're going to increase the benefit for their members.
Right.
So
and it's all ebbs and flows based on their ability to manage it well.
Correct.
So some year, this plan might take away this benefit, but then 2 years later, because they manage things better, it may come back. Or this one manages things better than this one, so you may not get, say, transportation to your doctor on this one, but because this one's well managed, you do.
So they look at it as a whole, both the HMO and the PPO, because the money amount that they get from the government is still the same, right? It doesn't matter what. So that's how they do it. So if the PPO, they spend more money to pay for the claim, they don't have much left, then of course the benefit's going to be less.
Right.
Typically, a plan, they usually keep about 4 years. And then after that, they start to phase that plan out.
You're talking about the insurance carrier has, this is our plan. And then at the end of 4 years, when they kind of look at what works and what doesn't work, they start making changes.
Yeah.
So what changes do you think are coming up? Do you see, because we're about a month away from an enrollment period.
Yes.
Which, for all of us remembering, that's the time that you can make changes to the existing plan that you have.
Correct.
It's a different enrollment than when you're going to be 65. This is I've already got a plan. I don't like my plan, or I do like my plan, I make change. But the insurance carriers make changes as well, right? So what do you see coming in this new enrollment period that people need to be aware of?
The biggest change for 2025 and continue with 2026 is prescriptions.
Yeah, that's what I keep reading.
Yes. Historically, Medicare has the donut hole. Yeah. Well, that got taken away in 2025. In 2024, your maximum out-of-pocket is $8,000. So that went away, and then a maximum in 2025 is $2,000, and then it'll go up to $2,100 next year. So the premium. And
that's a deductible.
No, that is the maximum out-of-pocket.
Maximum out-of-pocket.
Yeah. So that's where the big difference is. So it's can you imagine it's $8,000 where us as a Medicare beneficiary used to have to pay. Now we only have to pay $2,000.
That's a good thing.
It's a good thing for us, but then it actually, in a sense, it's really not, in my personal opinion, because there's a $6,000 difference. Now the insurance have to come up with something. So
they're either going to have to suck it up and lose money.
So what happened is historically we never had to pay for deductible. So because of that, now the insurance carrier have us to pay for deductible. Because the way how Medicare, which is CMS, created in such a way that now the pharmaceutical had to pay a little bit more, the insurance carrier had to pay a little bit more. So, it's kind of eat up their profit, right? So they had to figure out how to do that. So now they just kind of spread it evenly to everybody. So for someone, let's just say I'm healthy, but you have a heart condition. You're on a lot of medications and cost you a lot. You save money because you used to have to pay $8,000, right?
Right.
Now you only have to pay $2,000. But I'm healthy. I didn't need any. So now some of that.
And you never were paying part of the $8,000.
So now I'm kind of help subsidize that money for you. So, you're kind of like Robin Hood in a way.
Yeah.
Sort of.
Yeah, it's spreading the risk, right? I mean, that's the whole point of insurance, right? You're all paying into a big pot. Some of us are healthy, some of us are not. Everybody is subsidizing everybody else's at various different times. I get that part.
Yeah.
And I know it can be very, very confusing. And that's why having a person like you be able to answer those questions, I think, is important. And I would encourage people to call, right? And we're going to make sure that your information is published so they can reach out to you. Because what I want people to not do, what I don't like is people making decisions based on rumor and innuendo. I love my mom. I'm very blessed. She lives with me and we talk a lot. Not as much as she would like, but certainly a lot. And she says things to me all the time, well, you know, they say blank. And I'm like, well, who's they, Mom? What do you mean? Well, who's they? Who is telling you these things? Well, it's, you know, the news or this. I said, let's get the credible information from the people who really know. Let's not make a decision based on who they are, because we don't know what they know. They may not know anything. And they may be just pulling it out of their ear. We have no idea. So I love the fact that you answer those questions. So before we wrap this up, what should everybody know that we haven't talked about that would make a difference in their life in the coming year?
I think in general, when it comes to health insurance, whether it's, you know, under 65 or 65 and over, it's so important to think, okay, so does my carrier has the doctor that I need and want? Does it cover my prescriptions? How much does it cost me? Right? And so, and understand what is co-insurance? What is the deductible? And make such a big difference. Just understand, because when you become seniors, you're on a limited income. And so you need to understand what all those words mean and how is it, and it's budgeting as well. So like say next year, the benefit's going to be less. It will be. And
it has to be, just through the sheer fact of everything costing that much more money.
Yes. And so when you talk to your agent or to an agent, so make sure that you ask all those questions and really understand it. And then say, okay, well, let me see. For budgeting, I go to see this primary doctor 10 times a year. So then budget your money out. Again, it's basing on, you know, your own budget. So things like that. And then when it comes to dental, then say, well, this year you went to see the dentist and he said that you need crown or bridge or something. Well, now I know next year I need to have it. So now I'm shopping for a plan for next year. They're only going to give me $2,000, but I need $4,000 for my dental. So what am I going to do with the other $2,000? Things like that to think about.
Makes sense.
Yeah.
Makes sense. I think what I'm hearing from you is, because we're getting close to the enrollment period, you actually also should be notified or getting close to getting notified of your plan changes, if not already.
Yes.
And so much of it is gobbledygook anyways. Like people, I look at big things that are printed and I go, and I freeze. And I imagine I can't be the only one, right? I'm not going to sit there and go, okay, let me look at this. Let me look at last year's. Let me look at, and
I am glad that you mentioned that. It's called annual notice of change. They by law, they're mailing it out on September the 15th. So 80 days now. 80 days now. When you receive it, they're only going to show you what is different this year. So let's just say for next year. So say this year, your primary visit is $0. But next year is going to be $10. So they show that. But is it the same? They won't show that. So they're only going to highlight what's actually changed. This is where an agent comes in for you. If you receive a letter or a call from your agent and say, hey, let's meet, because they really do care about you. They say, let's take a look and understand what does that mean by that notice of change. So you can make, because, you know, health change. Right? It's not every year, then every other 2 years.
Right.
So it's good to revisit, even though you love the plan, you think it's the best there is. Well, plan change as well. Your health change. So it's best to looking at it at a minimum of every 2 years.
And be objective about what do I think my health is going to be over the next 12 months. Because once you're in till next October, November, December, right? I mean, actually October, November, right? It's 45 days.
Well, depend on the plan. If you are, it's called Medicare Advantage plan, you actually have a remorse period. So any time between January the 15th to the end of March the 31st, you actually get a chance to switch to a different plan.
If you don't like the one that you chose. If you don't like you chose, or you make a mistake, whatever that may be, right? So you get a chance to do that. Another time you can change if which all the state has it, is called the chronic condition. So let's just say that the doctor just told you that you have a heart condition. Because of that's considered chronic conditions, then you get a chance to choose a different plan that's specifically for that.
Most of the time when you have a chronic condition like a hypertension or heart conditions or lung disease or diabetic, those are the times where your medication is costly to you, majorly, right? You're going to take more. So the government CMS allow you to switch to a plan that help you with the cost of the medications. So that's when you also have changed. There's so many scenarios, but in general, those are the two that you can change outside of it's actually called annual open enrollment.
Right.
So that is October the 15th to December the 7th. But the other one is called OEP, which is open enrollment. It's so completely different.
Yeah, and it's similar enough that it could be very confusing.
Yes.
Not to mention the fact your original enrollment period, when you're like going to be 65 and you have 3 months before your month of your birth and 3 months after, and that's confusing enough, and who has to do it and why you have to do it. And that's all conversations why people need to call you. So I really appreciate you coming in. This is very helpful, and by all means, I suggest people give you a call and just ask questions, because I think if they start asking questions, that would be a good reason for you to say, you know what, let's just sit down. Let's just have a conversation and look at what you think is going to happen in your life. Let's look at the history of your family and make some decisions based on what could be, because all insurance is about what could be, not necessarily what is. And so making that decision, then you can choose. And Sandy's going to help you guys make the decision based on facts, not innuendo and rumor. So great job. Thank you so much for being here. I appreciate you.
Thank you for inviting me.
Thank you.
So thank you.
Thank you so much for joining me today on the podcast of Living Well and Aging Smart. I trust you got something out of it. And here's the thing, it's never too late to learn and educate yourself about the next step in aging, whether it's getting some clarity, learning about safety, or more importantly, being confident in the community that you're in. Today's episode, hopefully it resonated with you. If it did, make sure that if you have questions, you can give me a call. Make sure if you have questions, you can schedule a call to meet with me on the phone. There's a link in the description. There's lots of things that you can do, but more importantly, do something. You can call me directly on my cell phone, 702-303-0040, or better yet, you can even go to the website, seniorassistanceteam.com. I have lots of resources and guides there available to help you. Please don't forget, if you watch this podcast, like it, subscribe to it, share it with somebody you think would benefit from it. More importantly, please leave a comment and help me get better here so we can serve your needs as best as possible. Have a wonderful day. Remember to continue to live smart, age well, be smart, and stay safe.
I ain't tired of rock and rollin'. I'll be dancing till the morning.